This week we are going to start with Chapter 2, which is about why public health is controversial. So we're going to talk about a few subjects such as HPV vaccine and why religious groups are kind of against it, and a few other examples kind of like that. Also how politics kind of ignores science a lot, and how public health professionals can kind of work to alleviate some of these people's fears or concerns by using evidence, which can help, change their minds sometimes. So you'll see, we'll go through. So in public health history, there was a few remarkable people who came up with the term social justice, which is you know, a main thing in public health versus market justice, which is more about the economy. So with social justice, it's more about making changes for everyone. In the textbook, it talks about the common good. Um, we're trying to help everyone live to their full potential. So that's kind of social justice, and that takes into account a living wage, so income, housing, cheap, high quality housing, having a good job, being educated, or at least having the option to be educated, and then access to healthcare. These are all fundamental rights. That's kind of what social justice is based on. And last week we talked about social determinants of health, income, housing, all these things, how they really impact your health negatively, even more so than access to healthcare. But then people on the market justice side, they often argue for individual responsibility. So, they kind of put more pressure. It's up to you to, get a good income, get a nice house, get a good job. But there's so many barriers out there. So these are two conflicting thoughts on, society, and they really impact how money is funded in public health, and what type of programs are most successful. So as you read through the textbook, just kind of pay attention to those two big differences. And with these two, they often conflict in, like, what does public health really have the right to um, impact? Like, how many things can they change? Can you stop a person from smoking? We know smoking's bad for a person's health, but like, what's the scope? How far can public health really go? So we'll go through and talk about some of these examples. So some of the main sources of controversy are economic impact. So a lot of times public health programs cost a lot of money, and it's really hard to measure the impact. And oftentimes it's not adding a lot of money to the economy, it's more adding, value to people's lives, so they'll live longer. Um, so oftentimes that's kind of not the best argument for public health, because you're not really making more money, you're just helping people be healthier. Again, the individual liberty. Should people be allowed to do things that are bad for their health type of questions. Moral and religious opposition to public health. Safe sex, contraception, abortion, things like that. And then political interference with science. So oftentimes people are more concerned with getting reelected than, understanding the science correctly and doing the best thing that way. And then the money gets into that as well. So let's start with economic impact. So again, like I was saying, most public health programs, they cost money, they don't really make money. And oftentimes many of the environmental regulations and things of that nature have a negative impact on industry. So you can think, if I'm building cars and now I have to add all these extra parts to cars to make them more energy efficient so they pollute less. I have to spend more money. I have to charge more for my cars. Am I going to sell as many cars? So, by doing these regulations, it can have a negative impact on businesses. But again, you have to measure that against the benefits to health and, environment, things like that. And then people also argue that the people who pay are not the ones who are really benefiting for a lot of public health programs. So you can think of like a free clinic in a big city. So a lot of higher income people's taxes will fund that free clinic. Um, so they're not going to use that clinic. So they argue, why am I paying for this clinic? But again, we're going back to this social justice argument, trying to provide everyone with the option to be healthy. Again, in public health, the costs oftentimes may be short term, building that clinic, hiring staff, and the benefits they may take like, 20, 30 years to see. Um, so, with cars and clean energy, all those things, we may not see all the benefits for a long time. So politicians, they want those quick turnarounds so they can, you know, claim that they made a big difference. If it takes 20 years, they don't know if they'll be around by then. So these are some of the main economic reasons that public health programs, are hard to sell to certain groups of people. So the book really talks about the tobacco industry as an example of how the U.S. prioritized economics over health for a long time. Um, so as we've talked about over and over again, tobacco is the #1 leading cause of death in the U.S. And it's really costing the government millions of dollars in medical costs. Um, but for a long time, the tobacco companies were making tons of money all over the country, so they kind of turned a blind eye. And then eventually in the 90s, all the information came out, and then they started, really restricting advertising, etc. But I always like to talk about Las Vegas, so I did my PhD there. And Las Vegas has the Clean Indoor Air Act, but this isn't a comprehensive Clean Indoor Air Act. I'm sure a lot of you have been to the casinos in Las Vegas and you noticed you can smoke all over the casinos. Not in the restaurants, but pretty much everywhere else you can smoke. And the casinos are the largest employer in Nevada. So you can just imagine all those workers being exposed to smoke 8 hours a day, 5 days a week. And as we've talked about secondhand smoke, there's no safe level of secondhand smoke, so it increases their risk for all these heart disease, cancer, COPD, all those conditions. And it ends up costing Nevada millions of dollars. Well, it will eventually, once these people develop illnesses. But the casinos have lots of political power in Nevada because no one pays state income taxes because the casinos pay all of the taxes. So you can see how this is a good example for this whole chapter. Why is public health controversial? So in Nevada, it comes down to these casinos are, the main driver in the economy. So the politicians really aren't going to crack down because the casinos think they will lose a lot of money if they had to outlaw smoking. But on the other public health side, we know smoking's bad. We're exposing all these workers who, a lot of them probably don't even smoke. They just want a job, to provide for their family, but they're being exposed to this toxin, carcinogen every day of their life. So you can apply the same thing to every public health issue. So I just always like to give this example in my classes because it shows, despite the knowledge we have, it's really hard to make those changes to really prioritize health over money, and it's going to be a battle forever. But you know, lots of people are still working to change those issues. So another important thing to talk about is funding for public health. So um, I'm not sure if I've said this before, but we spend $3.5 trillion on healthcare. Um, and, you know, for all that money we're investing, lots of research has shown that the medical sector can only really impact 20% of people's health, and public health, on the other hand, can impact 40%. But we only spend, 2.5% of that 3.5 trillion on public health funding. So obviously this is very underfunded, and depending on the economy and what's going on, oftentimes the first thing they cut money from is public health programs and initiatives. So yeah, it's always been a struggle, and you can see on here in 2018, public health funding increased 2%, but we're only spending almost 12 billion compared to 3.5 trillion, so it doesn't really compare. So this graph shows in the red is how much the government has put towards public health funding after they cut, and the blue is what they're supposed to be funding based on the Affordable Care Act. This is the increases they were supposed to be making on prevention services. So putting this money in what's called the prevention fund. And you can see as of, currently we have never met the recommended funding levels. You can see in 2028, it's kind of projected that maybe we will get there to the recommended funding levels, but we'll see. You can just see we're already cutting money from public health to pay for other things, wars, our military, whatever it is. We're not meeting these recommended funding levels. So the book also talked about the tragedy of the commons. So I'm not sure if you read that, but the story is, let's say we're all herders of cattle, and we have one big field, and we all agree we're going to feed our cattle on these fields. But if one of us lets all of our cattle in and it eats all the grass, then there's none left for everyone else. So it's kind of like we need to share, or we're going to deplete it and we won't have anything for our animals, type of thing. So the book talks about, should the freedom of individuals be restricted for the well-being of the population? And that's a big question. Should we stop people from smoking? Should we outlaw drinking soda? So like taking away some of these freedoms to improve the overall health of the U.S. Another one is with guns. Guns is a huge controversial issue. Lots of people say we should outlaw guns, there'll be less gun violence, but then the other side is, they have the right, it's in our Constitution, Second Amendment. So we're going to be dealing with these types of issues, arguing on both sides for a long time. So, what should be included among protected resources? We kind of have to prioritize what are the best things we should be, ensuring restriction on. So with climate change, we really need to be focused on reducing pollution. Also with water pollution, things that impact thousands of people at a time. Obviously, we don't want what happened in Flint to happen somewhere else. So, we should stop other people from polluting, things like that. But with smoking, alcohol use, even with drug use, we're becoming maybe more, giving more freedom to those things. And then, with the environmental stuff, maybe more strict. So the book talked about a good example in LA, what they've done, um, you know, to reduce air pollution. So they have done a lot of things that have, fringed upon the right of individuals to pollute. So they banned gas lawnmowers. Um, they don't let you build new drive-through banks or fast food restaurants. So, you're not idling your car. Even they went as far as banning charcoal lighting fluid. So you can think all these are kind of individual choices type things, but they've banned them. So they restricted them to protect their air quality. Um, and overall the population accepts this because they remember 30 years ago when the smog was horrible, and it's a lot better today. But then, we always have people on the other side saying these laws are too strict. Um, and that's going to be the same with every issue. So when can the government restrict individual freedoms? So in the United States, our laws and regulations are kind of set up to do this when we're preventing harm to others is kind of the standard. So, um, if you're smoking inside and you're harming your children, that's kind of a tricky one, but potentially public health could come in and do something, child protection services, things like that, get you to smoke outside, something like that. Um, the book also talks about calling this paternalism. So, like, you're just being a parent. And they said it's only acceptable for laws concerning children. Because they say the children aren't developed, they don't really understand how to protect their health. Um, so, like, the argument is more libertarian people say seatbelt laws should only apply to children, same with helmet laws, and even like drug use. These laws should only apply to children. Adults should be able to do whatever they want because, that's their right, individual freedom. Um, and in the US, we have a long history of this. And depending on the state you live in, maybe you don't have a helmet law where you live, or, in Nevada, marijuana was recently legalized. So you can see how the populations around the country kind of change on these issues and what they think individual freedom should apply to and what it shouldn't. So, but if we look at motorcycle laws, here's just how a person from each side would kind of argue. So if you're more a libertarian, you would say there should be no motorcycle helmet laws because it's their body and their right to not wear a helmet. And if they don't wear a helmet, it's not really harming anyone else. If they, crash, it's really only harming that person. It's their, freedom to choose that. The other side, the common good argument, they will say, if you're not wearing a helmet, it can make you a dangerous driver because let's say you get hit by, you know, a rock or something, it causes you to crash or crash into someone else because you weren't wearing a helmet. So it makes you more dangerous. The other things they argue is that your injuries from if you do crash without a helmet drive up insurance costs, medical insurance, and auto, motorcycle insurance. And the last thing is like a helmet could save that person's life. So, that's the last argument. So you should wear it just to save, potentially save your life. The next main type of controversy is the moral and religious opposition to public health initiatives. And this comes up a lot with anything related to sexual health and reproduction. So, when we had HIV/AIDS, STDs, teen pregnancy, and low birth weight babies, these are all major U.S. public health concerns. But if you kind of view sexual activity as a immoral behavior, you may be against, sexual education, giving your child the HPV vaccine, giving away free condoms, having access to abortion or birth control, depending on your religious or moral beliefs. So these can be barriers, and depending on the state you live in, again, um, a lot of these public health programs will either succeed or fail based on public support, which is greatly impacted by these beliefs. So that's something that we are still dealing with today. So just jumping in on HPV to give you a little more information. So if you're not aware, HPV is the human papillomavirus, and it is the most common sexually transmitted infection. So every year there's about 79 million Americans that are infected with HPV. And most people, it just cures naturally and it doesn't cause a lot of issues, but in a small percentage of this infected population, it can result in cervical cancer and some other types of cancer, tongue, throat, things of that nature. In both, cervical and females, but then in males, they get all those oral tongue cancers. So we've had a HPV vaccine for about 20 years or 15 years that can basically reduce your risk for these cancers to almost zero. But again, depending on your moral and religious beliefs, you may see this as a risk, like you're promoting sexual activity, or giving your child like the pass card, oh, I got you this shot, so now you can go have as much sex as you want, type of thing. Or, kind of showing that you approve of sexual activity. So that's kind of the argument. So a lot of parents are hesitant. They say, why should I give my 11 or 12-year-olds, because that's when you're supposed to start the series, why should I give them an HPV vaccine? They're not sexually active. That's the argument. But the counter argument is because it can prevent cancers, and this is the most common STI. So when they do become sexually active, they have a high risk of getting HPV. And again, this may lead to cancer someday. So do you want to protect your child from potential cancer? And then you can also reference research showing that it does not increase sexual activity, which I'll get to in a few slides. So here's a graph of the US showing the current vaccination coverage rates for HPV. And you can see South Dakota is about 65 to 69% of children are getting the vaccination. And if you just look around the country, maybe some of the more conservative states are, less than 60, 50 to 60%. So you can see how that's impacting rates of vaccination coverage. Here's just a zoom in on South Dakota. So this is the number of rates that complete the whole series. So that first slide was just getting the first shot. So overall in South Dakota, only about 50% of youth get the whole series. And depending on your county, again, this is impacted by religious and moral views and access to healthcare and other things. But there's a variation within the state. So you can see that. But like I was saying before, researchers have done a lot of studies, so they'll do like follow-up surveys with middle school and high school students to see if you're the student that got the vaccination, were you more likely to have sex like earlier or more often, have more partners? And consistently, the research shows that it doesn't matter if you get the HPV vaccine, you're not more likely to have sex earlier, and you're not more likely to have sex with more people. So, providers or public health educators can use this to kind of show them overall, you may have this concern that if you give your child this vaccine, they may be more likely to have sex, but consistently the research shows the opposite. So it's just educating providers and parents about these findings to alleviate their concerns, and then hopefully they'll use the vaccine. I just put in this graphic because for your health communication plan, you need to be working on developing 2 infographics. And you can use or modify infographics that already exist. So if you find a good one, just kind of reference it and change it to fit your program as you're working on that. But this is just a good example, taking some of that key information and making it look really nice. So 2 and 3 adolescents have started the HPV vaccine, but only 1 and 2 finishes it. They're up to date. So we're 33rd ranked in the US for, getting the vaccine. And then, below there's some of the education. So it's the number 1 is HPV vaccine is cancer prevention. You're preventing the cervical, oral types of cancers. Then they tell you when it's recommended, and then HPV vaccine is best to start when they're 11 and 12 years old. So when you're working on your health communication plan, just try to find things like this or make your own. This was just a good one I thought I would share. So with the moral and religious opposition, this applies to sexual education. So around the country, sexual education can be abstinence only. So they don't teach anything about condoms or birth control, or it can be abstinence based. So they'll do a little bit of both. They'll teach, the best is to not have sex, but if you do have sex, use the, condoms or birth control. And then CDC has a comprehensive sexual education recommendation, and that you can still teach abstinence, but you really have to focus on the science about sexually transmitted infections, the best practices for contraception, so birth control, condoms, all of that. But then you also teach about abortion, and recently CDC has really expanded their comprehensive sex education to include information on homosexual sex, which has been ignored in schools forever. So imagine you're a gay or lesbian person in high school and you go to sex ed. Historically you don't learn anything about gay sex. So CDC has been working with many of the more liberal states, California, New York, and they've really been implementing more LBGT sexual health topics into their sex education programs. But you can see on this slide, in South Dakota, we're a little bit behind. We're not doing comprehensive sex education. So they require that abstinence is taught. They do include sexual health education, but it's not really specified what that means. The regulations don't, specify. Do they teach about HIV? Do they teach about STDs? So this leaves a lot of wiggle room for each county or school district to kind of set up their own sex education program. And I've talked to a lot of the pharmacy students that grew up here, and they kind of said, they really didn't get much information in their sexual education courses. And this is linked to higher teenage pregnancy rates. Maybe not so much in South Dakota, but in other states, the worse the education is, more STIs and more pregnancies occur. So just something to be aware of and thinking about. So here's a graph just showing among teenagers. So they did a survey to see who received formal sex education by topic. and males versus females. So you can see most people reported receiving some type of sexual education and how to say no to sex. So yeah, that's another thing they're trying to improve, consent. But you can see where it drops down the most is methods of birth controls or birth control, and then how to prevent, HIV/AIDS. It drops down a little bit. So overall, maybe those are a few things people are missing, especially the birth control aspect, which, a lot of states do not allow you to teach that. So one of the next big controversies is politics. So our politicians don't always base their decisions on science. There's a lot of other things that they are prioritizing, funding, the people in their district, what do they really want? So depending on, who's in charge of the government, there's always a risk of, politics getting in the way of public health. So the book talks about when George Bush was it president, there was a lot of his policies or his actions misrepresenting science to support, its policies. During this time, he ordered CDC to remove effective information from its website, and that's occurring now too with the Trump administration. They don't allow the EPA to mention climate change. So this happened, a lot of this same stuff happened during the Bush administration. Um, during the Bush administration, they had their Council on Bioethics, um, which could really impact, abortion, things like that. And when Obama was in, the book points out he made efforts to inform policy based on science, but both historically, both Democrats and Republicans have, had issues at certain points where um, they focus on the politics instead of the science. So there's a website out there that tracks the Trump administration's attack on science, and they've actually been doing this for every administration for quite a while. So if you click on the link in this slide, you can go to there and see, um, what the current administration is doing. And you can see a few of these. I just pasted in. So EPA stops collecting data on pollutants released from farms. So, this is partially because they want to be pro-farmer. They don't want to, regulate farms or have the data to regulate farms. And the argument is cows or, livestock or even just growing crops can produce a lot of greenhouse gases. So we need to be monitoring those. And then on the right, one that's kind of close to here, Minnesota mine approved over objections of the EPA scientists. So um, the EPA didn't allow the scientists to submit their written comments saying they did not approve this mine. So it got approved and there was no input from the EPA. So you can see there's tons of examples like this. If you're interested, just scroll through that website. It's kind of interesting. Okay, so that's it for the main types of controversy. So now we're going to jump into some of the psychosocial factors and how they affect health behavior. So this is chapter 14. And we're going to jump into some of the health behavior change theories a little bit. And you'll discuss this more in your later classes, but it'll be kind of a brief overview of that. So again, we kind of talked about this last week. The most important predictor of health is socioeconomic status, because if you're lower income, you live in worse neighborhoods, you're likely less educated. So, all those factors impact worse health outcomes. And then, the health gradient holds at all levels of the social scale. So as you move up, you get healthier. Again, we talked about a lot of health disparities and how race and ethnicity, gender, all these things can also impact your health. Um, so it's good just to be aware of those, and the book talks about this some. And these are key issues in public health that we're trying to identify the best ways to improve, people's SES or, reduce these health disparities. How do we get people all kind of at the same level or playing field type of thing? So again, we talked about this a little bit last week. Why is SES so important? One, nutrition is huge. They're often more likely to be food insecure and eat more fast food, live in food deserts, and just not either have the time or the knowledge to eat healthy or the money. So we talked about that a lot last week. Sanitation, do you live in a poor neighborhood? It's dirtier, more exposed to pollution. So conditions of your physical environment, walking past sidewalks, crime, all these things. Um, so we talked about a lot of these impacts last week and why SES is so important. But when we get into the psychological factors, we didn't really talk about stress too much, but stress is a huge factor in your overall health. So, and one of the biggest factors in making people stressed is financial issues. But research has shown that your mortality increases after, the death of a spouse, a loss of a job, a divorce. So any of these big, huge, stressful events in life, um, your risk of dying goes up a little bit. And then, heart disease and common colds, our risk for that goes up the more stress you have. And then if you're more stressed out, you have higher cortisol levels. It makes you eat worse. It makes you think less clearly, sleep worse. So there's all these things going on. And then research has shown the lower you are on like the social ladder, so if you're lower class, low SES, you have more stress compared to other people. And then, there was a big study, the Alameda study, showing that the more support you have from your community, your friends, your family, that really gives you a buffer to stress because there's people to help you. Let's say you lose your job. If you are really connected, you're close with your community, your friends, your family, they may help you find a job, and until you do, they'll be more likely to help you. So they call it this stress buffer. And we're really losing this in our modern society because we become more disconnected with our neighbors and our communities. Um, so that ends up increasing or making these, huge stressful life events even more stressful because we have less people to turn to, less community. So that's something a lot of people in public health are also trying to change as well. So now we're going to jump into a few of these health behavior change models. And one of the first ones created was called the health belief model. And some researchers, um, they had this idea like, we'll offer free screening and treatment for tuberculosis, um, and we'll just see who uses it and why they use it or why they don't use it. And what they found really is that what makes people change their behavior is if they feel vulnerable to the threat, they think the threat is serious, and by taking action, I can protect myself. So these three things were super important, especially now. We use these a lot in public health. So first, you have to educate people about, you know, smoking is bad. Teach them why it's bad. If I smoke, I have an increased risk of getting lung cancer. So I'm vulnerable to getting lung cancer. How serious is the threat? So lung cancer is pretty serious. If it was like if I smoke, I might get a cold. That's not as serious, so people would be less likely to quit smoking. And then the last thing is you really have to say, if I quit smoking, I can protect myself. So if I quit, am I going to be, my risk for lung cancer, is it going to go away? Which for smoking, this has worked pretty well. With other things, you can see how the three areas can kind of vary. So here's just a little flow diagram of the health belief model. So again, we have perceived benefits versus perceived barriers, perceived threat, self-efficacy, and cues to action. And then also we talked about the perceived seriousness. So how serious would a disease or outcome be, and how susceptible am I to getting that disease or outcome? So if we think about HIV, let's just do it. You want people to practice safe sex. So the first thing you have to ask them is like, how important, or like, if you did get HIV, how serious would that be? So that's a lifelong disease. It increases your risk for other things. So maybe the person would assume that that's pretty serious. But then you ask them, how susceptible do you think you are to getting HIV? And they've done this study, and most people say, I have like a 0% chance of getting HIV. I only hook up with, clean people. And this is what people perceive. And this is kind of a problem with safe sexual practices, is most people don't really perceive their susceptibility or risk to getting an STI even as very high. So you take those two together, and that overall will be your perceived threat to HIV. Um, and then the benefits versus barriers. So the benefits of using a condom, I won't get HIV, my girlfriend won't get pregnant. Um, the barriers, condoms cost money, it doesn't feel as good, stuff like that. Self-efficacy, so do I know how to use a condom? Do I know where to get a condom? Um, those are two big ones. And then cues to action, these are things like commercials or reminders, things that can help people to use condoms. Um, and then overall, all these factors together, they all are impacting the likelihood of someone using a condom or not. That's just kind of a quick overview of how this works. And this is one of the big models that are used to develop like education or prevention programs. So self-efficacy was in there, and self-efficacy comes up a lot in health behavior, so people really need to, um, and it's perceived self-efficacy. It doesn't even have to be real self-efficacy. They have to believe they have control over their life, um, that they can do whatever the behavior is or change, have the knowledge, skills, ability to do whatever they want. So if we think about working out, um, do I believe I have time to work out? Do I have the knowledge? Do I know how to work out, like run? Do I have shoes? Am I able to perform or, have the skills to go do it? But, a lot of research has shown that learned helplessness is a pattern of numbed acceptance of a negative situation. So a lot of people, they just, I can't work out. I don't have the time. I don't have the money. I don't have a gym membership. I don't have, it's kind of like the number of excuses a person could do, whether they're real or not, kind of leads to that helplessness. And it's helping people kind of overcome that and realize you don't need a gym membership. We could teach you, a few things to do at your house, um, things like that. So self-efficacy is very important in changing behaviors. So the next model the book kind of talks about is the trans-theoretical model. So the TTM is what this is called. And this is really, you may have heard it called the stages of change model. And this has been really successful, especially in like medical field, or helping people smoke or eat better, because it assumes people are at different stages of change. And depending on what stage you are in, you need a different intervention. So we'll go through each of these, but pre-contemplation, you're not even really thinking about changing. Then contemplation, okay, you're considering, quitting smoking. Then you move to preparation, you're preparing to quit smoking. Then you actually take action, I start using nicotine patches, or, I go cold turkey. And then the last one is maintenance. So, you have to keep not smoking type of thing. Keep working on it. Um, and this isn't contradictory to the health belief model. It's just showing that people are at different levels of change in their life. So again, here's just a nice little overview. Pre-contemplation, not aware, uninformed, no intention to change, not ready to change at all. So you don't want to waste your time doing a big intervention with people who are in the pre-contemplation stage, because you're going to be wasting your time and energy. For this group, it's really about educating them, so that they may move to the next level, which is contemplation. So these people, they're aware there's a problem and they're thinking about changing, but maybe they don't really know how they should be, or what the best approach is to make a change. So the first one is pre-contemplation is general education, contemplation is more specific. These are some things that you could do that have been shown to work. And then preparation, they're ready. So you really help them make a plan of how to, exercise, quit smoking, eat better. And then once they're in action, the next one, within about, this says 6 months, they're taking action. They're starting to work out, starting to eat better. They quit smoking, so they're using their nicotine patch, whatever it is. And then after they've been in action for 6 months, they're considered, to be in maintenance, where you have to keep up the same thing, to prevent, relapsing. You don't want them to start smoking again. And then depending on what type of behavior you're changing, you can say termination if the person is never going to do that activity again. But some people say there's no such thing, because you could always, go back to a certain behavior. So we'll just go through an example from each level. So pre-contemplation. So a current smoker is not considering or planning to quit smoking in the next 6 months. So for this group, again, you just want to provide them general education of why smoking is bad and why they should quit. Contemplation. Smoker is thinking about quitting. She knows it is bad for her health and causes severe cough. So in this, you could teach her there's programs in your area, that will provide you nicotine patches, because she's contemplating it. So preparation, smoker is planning to quit smoking after her birthday in 2 weeks. She has talked to her doctor and has a prescription for Chantix. So she set up something, put it in motion. She's really ready. She's about to start. So action, she has not smoked in 3 months, is taking her medication, and practicing yoga to manage stress instead of smoking. So in this action stage, you're just giving them the tools and resources to continue not smoking. So linking her to yoga was a good choice in here, in addition to her medication. Maintenance, the smoker has experienced 15 months of abstinence. She no longer needs medications to resist cravings and avoids areas where others smoke. So a big thing in the maintenance phase is not going back to those habits or behaviors. So by teaching her to avoid areas where other people smoke, so that she doesn't have that temptation, that's a way to keep her in maintenance. And then termination, she hasn't smoked for 20 years, reports no cravings or desires for smoking, even in the presence of smokers. So again, like I was saying, termination, some people argue there's no such thing, but for any behavior, it's really rare, because you could always potentially go backwards. Um, the next model we're going to talk about really quickly is the ecological model of health behavior. And this is going beyond just a person's individual behavior and beyond like their family and friends, and even taking a kind of a broad picture of the whole, um, the whole different levels that impact a person's health, up to the, public policy, federal government, state government, community, and then institutions, your school, where you work, then interpersonal, your family, friends, coworkers, and then your own intrapersonal, the individual psychology. So this is taking this really broad view, and this is a great um, model to use to really identify everything that is impacting, one certain behavior. This is kind of the best thing to get that huge picture at every level. And obviously you can change everything at every level, but it helps you kind of identify where the biggest or most important kind of things could be changed and try to work at every level. So we'll go through an example and you can kind of get a better understanding. Again, so this theory, the main thing is that they believe there's multiple levels of influence that impact health behaviors, all the way from an individual person to their family, to your school, your work, um, then your community, other people, churches, all the way up to that public policy, those big policies that impact your health. Trying to look at, all these levels. So this is a big comprehensive approach to study, design and or interventions for behavior change programs. So I'm going to go through the CDC's colorectal cancer control program because they use a multi-level approach. They're going to do different things at different levels to try to increase screening for colorectal and treatment, you know, for cancer. So here's a good chart just showing all the things they kind of found that impact colorectal cancer. So obviously individual things, it's going to be like your diet, your exercise, things like that. And then you go up to interpersonal, so your family, your doctor, your friend. How do these people help you? Do they encourage you to eat good? Do they encourage you to see the doctor, to get screened? Then you go up to that organizational level. So like your health insurance plan, your hospitals, Medicare and Medicaid, professional organizations. So what are all these groups doing to either cover the cost or encourage people to get screened? And then if you go up even more, the community level. So is there survivor support organizations that kind of do outreach? Employers or work site, are they doing screening or being supportive? Media, stuff you see on TV, commercials, things like that. You go up to the biggest layer, the policy layer level, and you can see, what are like the cancer burdens and trends. So like kind of what's CDC doing, what's the data show, what type of clinical programs and policies are in place, so what CDC recommend, what are their recommendations, HRSA, all that, the Healthy People 2020 goals, So those kind of set how we spend money, how we prioritize our um, prevention plans and clinical programs, all of these big, huge national, state and national policies that can impact screening and treatment and things of that sort. So we'll just go through each level and kind of talk about what CDC did. So at the individual level, they were really focused on increasing knowledge and attitudes about screening and the intention to be screened, the risks and benefits of being screened, and access to affordable and convenient colorectal cancer screening, diagnosis, and treatment. So you can see at this individual level, they're really going back to that health belief model. So the need, they want you to feel susceptible, um, and they want you to see the benefits of getting screened. If I do get screened, it will reduce my risk for cancer. Um, that's a benefit. I don't want to get cancer, things like that. So that's what they try to do at the individual level. Interpersonal level, so they wanted to affect social and cultural norms and overcoming individual level barriers. So trying to change what your friends, family, and healthcare providers and community health workers um, understand about screening so they recommend and support. So it kind of becomes the norm to encourage everyone to get screened. Also, they want your provider, again, needs to make those recommendations. And then some kind of innovative things is just making sure patients receive reminders, text messages, calls, and then having these patient navigators helping you. Let's say you don't have insurance or you don't know where you can go to get it covered, things like that. So having people help you do that. So organizational level, so some of the things they were doing is promoting the use of client and provider reminder systems. So having a big healthcare system implement an automatic reminder system that sends text message and call. You can see by putting that huge policy in place, everyone enrolled in that health program or in that hospital or clinic, they'll all get that automatic reminder. Um, and then CDC was also encouraging coverage for the screening. And then with workplaces, helping workplaces support preventative care, giving people time off from work, things like that. So at the community level, a few things they try to do is work with coalitions and collaboratives to promote colorectal cancer screening. So they'll go out and do education, put up billboards. Health departments do this all the time, and same with like some of the community organizations like American Cancer Society, things like this. They do commercials, just education all around the city, depending, colorectal cancer is kind of older, 40s, 50s. So going to areas where people of that age are at and investing your time and money to educate them. And then the policy level, the two big things they were trying to do is to collaborate with coalitions to communicate policy decisions to the public, to increase insurance mandates for screening. And also changing some of the local policies, like your mayor could make, May Colorectal Cancer Awareness Month, something like that. So those are a few policies that could be changed. Oftentimes policies can have huge impacts, but they're often very difficult to implement because they're political oftentimes and they take a long time, lots of money, but they also often have the biggest impact. So it's important to consider, all these levels, because funding is always limited, seeing where you can kind of get the most impact for your dollar type of thing. And CDC does that a lot, so you can see they kind of prioritized a few of the other levels, and then here they just had a few suggestions. So this one's kind of hard to see, but it just kind of shows a logic model of the program and kind of the main things they were trying to do. I just wanted to put it in so you could see kind of how that ecological model can kind of work and be prioritized. So in addition to that program, there's been AIDS prevention programs that have used this model. And when HIV came to the US in the 80s, this is kind of what they used to change behavior once they've kind of figured out that this was a sexually transmitted disease. So at the interpersonal level, they want people to know they're susceptible to getting the infection. So first they have to feel like they have a risk of getting infected, and that there's something I can do that will lessen the threat of infection. So, condoms did, at first they weren't sure, but then, if I wear a condom, my risk goes down. And then last is kind of self-efficacy. I'm capable of making these changes. I can go buy a condom, put it on. Interpersonal level. So, this is big with sexual activity because if your partner doesn't support your new behavior, it's going to be a lot harder to change it. So if you all of a sudden, want to start wearing condoms and your partner's like, no, I don't want that, that's a huge barrier. So you need to have support from, the people in this example from your sexual partners to really have effective change. And then community level, obviously education, um, programs for bartenders and gay establishments. So this is kind of an approach, especially back in the 80s, the bartenders could speak with a lot more, um, you know, gay people than like a researcher because they would know you're not like from the community. A bartender, if you educate them, they could educate others, and they're um, more respected or more, they're part of that community. So it's better if it's coming from them oftentimes than from some academic person who probably isn't gay, doesn't really understand. So oftentimes at the community level, that's why you want to find these key community partners that are a big part of whatever community you're working with. If it's African Americans, lots of times public health programs have partnered with churches, like African American churches. Um, so you can see just with the Native Americans, you want to work with some of the tribal coalitions or things of that nature, um, because you do want this coming from the community oftentimes. And also, they really encourage the bartenders to distribute condoms to all the um, people in the bars, which was a great idea. And then if you go up to that public policy level, um, if you could get the government to invest money in free confidential HIV testing, it makes it a lot more accessible and, you know, removes the barrier of cost, but having that confidential part also removes a lot of the stigma, especially back in the 80s. So you can see kind of how that ecological model really works it can work for like any big issue in public health, and it's a great way to see all those different layers and levels. So changing the environment. So we can try to change people's behavior. That's one approach, but you can also try to change their environment, um, which has actually been shown to be more effective than changing behaviors. Behaviors are very difficult to change. An example can be, let's say if I had a magic wand, I could go into an area of a city that has like 20 fast food restaurants and just close them all and put two huge grocery stores up. If I outlawed fast food and they only had the choice to go to the grocery store, and let's say I wave my magic wand again and the grocery store only has healthy food, like it doesn't have any processed food, it has like fresh fruits and vegetables and like lean meat, whatever. If I could change the environment and that's all they had access to, it doesn't matter what their behavior is because that would be their only choice. So that's kind of what the book is saying here. If you identify ways to really change the environment to kind of twist people's arm, I don't know how else to say it, you're really trying to force them to behave in a certain way, it's the most effective way to have positive outcomes. But it's also super difficult to do that because we don't have magic wands. Um, so this is kind of difficult in public health, but it is kind of a big goal with public health now, to start anytime we make a big change to a city or anything that we really think about health, um, when we're making those changes. And when you focus on changing the environment instead of the behavior, so like instead of blaming someone, you're just lazy and you just eat garbage all day because that's your choice. You don't even try to eat good. If you've changed the argument to I'm removing, all this junk food from your neighborhood, it changes the blame from the victim to like showing that the environment had that huge impact on their health. So the book talks about this was pioneered in injury control programs, um, because if you're working in a factory, um, if you change it to be a lot safer, then people get injured less, things like that, and like seatbelts, things like that. Um, it's also been shown to be effective in tobacco control programs. So you can think of how we've changed our environment in regards to smoking. You used to be able to smoke in airplanes, you used to be able to smoke in restaurants. Cigarettes used to be a lot cheaper. Now they're very expensive. The social norms have changed. People don't want you blowing smoke in their face. You have to go smoke outside. So, making it a lot more difficult to smoke actually reduces people from smoking. Um, so like I was saying, public health is really thinking on how to change our environment to improve diet and increase physical activity. You know, more parks, more sidewalks, more bike lanes, um, less fast food, things like this. But these are difficult changes to make. Um, Lots of the newer communities, like gated communities all over the country, they build their own gyms. So, we're trying to find better ways to change our environment, but it's difficult. But just don't forget, as you move into your career, it is far more effective than trying to change people's individual behavior.